So let's just do a very brief history of health reform in the United States. And I want to emphasize that this is a very brief history. Now, to be clear, 2008, when President Obama was elected and came in with the goal of reforming the U.S. healthcare system, this was not the first time that we ever tried to do so. For example, FDR tried to include publicly funded healthcare programs as a part of the original Social Security program in the 1930s. This failed. President Truman tried to get universal healthcare as part of his New Deal in 1949. This also failed. Medicare and Medicaid were passed in 1965 under President Johnson, and the benefits were gradually expanded to people under 65 in the 70s and 80s. Bill and Hillary Clinton introduced the Health Security Act in 1993, which would have mandated that employers provide health insurance coverage to all of their employees. This measure also failed. So the overarching message here is that the Affordable Care Act was not the first time that we've tried to reform healthcare in the United States. We have tried several times to do something about healthcare over the last 100 years. The resulting U.S. healthcare system is as much the result of our failures to do something as it is our successes. So let's look at some of the key provisions in the Affordable Care Act, at least as it was passed in 2010. Now, the Affordable Care Act is a very large bill that does a lot of things. Some of those things have changed over the last 10 years, but most of those changes are what I'm going to call procedural changes. For example, in the original text of the bill, companies would be fined for not providing health insurance to qualifying employees. However, that was ruled unconstitutional. Instead, the bill was changed such that the companies are taxed. Now, this isn't a change in the spirit of the law, but it is a change in the mechanism by which the law operates. So what are some of the key provisions of the Affordable Care Act? Well, for one, Medicaid eligibility expanded to include households making up to 138% of the federal poverty level. So for a household of 4, this would be equivalent to $33,000 or less. If you qualify for this, if your income is below $33,000 per year as a household, then you are eligible for Medicaid. The Affordable Care Act also subsidizes the purchasing of qualifying health insurance plans for individuals and small businesses for households making up to 4 times the federal poverty level, which would be roughly $95,000 per year. Okay, so if your household earns $95,000 per year or less, then you can qualify for subsidized purchasing of qualified health insurance plans. Now, this isn't the full list. There were also some changes to the insurance companies. So for one, insurance companies are not allowed to drop policyholders if the policyholder becomes sick. They cannot charge people different rates because of pre-existing conditions. Insurance plans must allow dependents, or children basically, to stay on their parents' insurance plan until they are 26. Plans must include checkups and other preventative care without copays. And contraceptives must be covered by employers and educational institutions with the exception of religious organizations. Okay? Now, again, these are not a full list of all the changes to the U.S. healthcare system, but these are some of the main core points within the Affordable Care Act. So who supported the bill? Well, to anyone who paid attention to the bill as it was being considered, it was obviously supported by congressional Democrats. Beyond this group of people, though, it was also supported by the AARP, which stands for the American Association of Retired Persons, and also the AMA, which is the American Medical Association. These are just 2 examples of people who supported it. Now, why was it supported by these groups? Let's think about the AARP. Let's think back to the discussion from the last series on adverse selection. When insurance is mandatory, high-risk people are effectively subsidized by low-risk people. On average, older people are higher risk than younger people. This means that insurance under the Affordable Care Act is cheaper for older people than it would be without the Affordable Care Act, and more expensive for younger people than it would be without the Affordable Care Act. This is also why the Affordable Care Act had such a hard time attracting young people to its plans originally. It was simply far too expensive to be worth it to these people. Now, what about the American Medical Association? Remember, people respond to incentives. One way to reduce the moral hazard of insurance is to require enrollees to pay a copay when they visit the doctor. Part of the Affordable Care Act was the abolishing of copays for certain medical procedures. Not all of them, but very many. What a copay does is discourage people from abusing their health insurance plans by making it a little bit costly to use their health insurance. Without the copay, however, more people will go to the doctor, which means the doctors can bill insurance companies for more things. So the American Medical Association stood to gain tremendously and financially through the passage of the Affordable Care Act. The same type of analyses can be done for other organizations. For example, America's health insurance plans, the AHIP, which is a group that represents the nation's insurance companies, supported the Affordable Care Act but strongly opposed the low penalty for people who did not purchase insurance. In other words, the AHIP loves that everyone will have to buy their product or their client's products, but does not like that the penalty for not purchasing their product was so low. Now, I should note this penalty here was eliminated in 2019 altogether. The AHIP was obviously very upset by this. So, who opposed the Affordable Care Act? Again, to anyone who paid any amount of attention to the bill as it was being considered, congressional Republicans opposed it. Aside from them, though, actually, small business owners, for the most part, came out against it despite the bill being designed to help them. Why is that? As it turns out, the Affordable Care Act is an incredibly complex document. The Act itself is 906 pages long and is written in the typical legalese that most bills are written. In other words, it is not something that the average person could simply read and understand perfectly. A lot of these pages are filled with requirements based on the characteristics of the small business, the employees, what sort of medical expenses they face, etc., etc. Small businesses thus face two choices. One, they could offer and pay for overly generous benefits packages to ensure that their plans are compliant with the Affordable Care Act. Or two, they could hire a legal team to advise them on what plans would actually be compliant given their situation. These are both very expensive. Big businesses often have HR departments dedicated to understanding the rules and regulations that affect employer-employee relationships. Small businesses, however, do not have HR departments, which means that the owner of the small business must figure these rules out on their own in addition to all the work of running their businesses. So what has been the overall effect of the Affordable Care Act over the last 10 years? If we look to a report from the Commonwealth Fund in February of 2020, we can find a few things. For one, the number of people without health insurance is at a mere 28.6 million, down quite a bit since its passage 10 years ago. Two, the cost of the Affordable Care Act has been much lower than projected, though we should point out, as the Commonwealth Fund does, that this is primarily due to slower growth in healthcare costs and lower enrollment in the Affordable Care Act and the exchanges than predicted. Finally, number three, the use of primary and specialty care services and access to prescription drugs is higher among low-income adults than it was 10 years ago. The report is very quick to point out that the actual effect on the nation's health is, quote, mixed and will require additional study. Unfortunately, this report was written in February of 2020, and immediately following that, the world was plunged into a global pandemic. This is going to make this additional study very, very difficult to actually accomplish due to the complex and incredible effect of the COVID-19 pandemic.